How do you use hypnosis in therapy? What can you use it for? And is it a complete approach in and of itself? Welcome to the Art of Therapy, Season 3, Episode 21.
We're really on an exciting journey of exploring hypnotherapy. And in the last episode, we really started to have a look at how does someone know how does a therapist know when someone is in a hypnotic state? And then also how to help a client discover that they actually are in a hypnotic state. So really looked at that and to explore that together the last time.
Yes, it's such an exciting journey as we explore hypnosis and hypnotherapy. There's so much richness to it.
There really is, yes. And it's also that we started to have a look at, or we said that we'll have a look today as just how do we utilize hypnotherapy in a practice, and what's the benefits of utilizing hypnosis in a psychotherapeutic practice?
Yes, the big development, or one of the big developments that we've spoken about, relates to the speed that one can utilize hypnotherapy. When we reflect on Elman and Dave Elman's contribution, it was really showing us how comfortably, how easily one can enter the hypnotic state and trance state with the relaxation approach, and how one can have deep hypnosis within minutes. I think when we looked at the demonstration with Cecile, that was probably closer to 20 minutes. But really what we were exploring there is how comfortably, how easily, how meaningfully someone can experience hypnosis. In Dave Elman's time, when he was training his doctors, they were going for hypnosis, and they had to be able to do and achieve deep somnambulism or deep hypnosis somnambulism within about a minute. So the big development is the comfort, the ease and speed of hypnosis, which really has made hypnotherapy something that we can utilize in the therapy room, that we can help clients with if we just know it, practiced in it, and incorporate it therapeutically.
It's like you say, it's so quick that someone goes in hypnotic states, and then there's a lot of work that can be done there, but it happens so quickly.
Yes, indeed. Yeah, if you take a close look at the demo that we did, one will see that Cecilia goes into hypnosis actually very quickly, because one does go into it so quickly.
Yes. I think just with also just experiencing hypnosis, I think one of the parts that I was just astonished by is just that absolute deep relaxation and how good you actually feel after just a short period of hypnosis and being in that state, and how good and relaxing that feels.
Yes. You really practiced in both the facilitation of hypnosis and you've experienced it. So you can, what you express is really very congruent and authentic because it's from your experience. Because that is a quality of hypnosis that so many refer to and talk about, that quality of relaxation. You don't need to be relaxed into hypnosis, but by and large, for many, hypnosis is associated with a very deep level of relaxation. And that quality of relaxation can be so therapeutic, because there are many who experience a very high level of stress, anxiety, and live in that state with really conditioned for very high anxiety, stress, panic attacks. And then when they experience hypnosis, they experience a degree of relaxation that's profound. For some people, unlike that they have experienced before, ever having remembered. So it can just in and of itself be profoundly therapeutic. So much so, as we've reflected, that someone would want to just stay there a little longer in the hypnosis state.
Yes, yeah. It really is just, it's like a physiological reset where you can just experience that deep level of relaxation
Yes.
and restorative nature that works with it.
Yes.
What are some of the other applications of hypnotherapy that practitioners can utilize?
Well, if we look beyond the immediate benefit of relaxation and that reset that you talk about, one of the applications is really for pain management. So many people experience either acute pain or chronic pain. And hypnosis, by its nature, is a state where there's this very deep relaxation. And as we become more relaxed, we register our pain threshold, the way we experience pain changes. But moreover, with suggestion in hypnosis, and especially if one's working with deep hypnosis, which is really somnambulism, which is the physical relaxation and mental relaxation, characterized by just that amnesia, just temporarily or momentarily one's in a deep state of hypnosis, somnambulism. That's an ideal state with which to assist someone to overcome and reduce and at times remove the experience of pain, because it can be so profound. Again, it's not a once-off. The more one repeats and someone experiences hypnosis, the more they learn the degree of control they have over the experience of pain. The experience is very real, the condition is real, and in the hypnosis, one is able to shift profoundly the experience of it. So, yes, anyone who's experiencing either acute pain or chronic pain and has really had that for years can benefit enormously with hypnosis and hypnotherapy.
Yeah, and just with that, it can be so meaningful and helpful for clients. It's like I say, it's the experience is real and the pain is there, but it is experiencing it in a different way, and that's the beauty part of hypnosis. That pain is experienced differently.
Yes.
And in that there's relief.
Yes, there's such relief for someone who's had pain and they just now experience just a reduction or just a near alleviation of it. And they are doing it. It's not happening to them. They are in control. They are doing, and that's an incredible experience, because part of pain is one just feels so powerless and just cannot break it. But in hypnosis, just that reduction or relief, and that one is doing it oneself. It's incredibly empowering.
And any client that can experience that and can learn that, it makes such a difference to them.
Yes, anyone can learn it.
Yes.
Yeah.
And then also, just when you mentioned acute pain as well, is that's also so helpful with any procedure or anything that you need to work with or need to undergo, that hypnosis can help with that then as well.
Yes, I mean, one can just look at, say, if one has many people have some fear of needles or injections, and they're really fearful of that. But if the doctor is trained in hypnosis, they can enter that hypnotic state very quickly, and they can have that injection or any procedure that's required without experiencing any significant pain. They have to, of course, want to experience it, but certainly children just go for it so rapidly. Sometimes adults need a little bit more persuading, but generally when we're in pain, we want to get relief. And so if someone can just experience and just try hypnosis, they can have profound relief there with acute pain.
It's so around pain, there's really a lot of work that can be done.
Yes. What I would add is something else that when it comes to childbirth, that it is possible that a woman can have great relief. If there's an experience of hypnosis, today would be called an hypnosis-assisted birth or hypnobirthing. But the quality of relaxation and the quality of that altering that pain threshold is so profound that that can be greatly helpful in childbirth, where there are those who've really experienced hypnosis and have utilized it, have found it to be profoundly helpful, and have gone through the birth experience with minimal discomfort, and also the time for the birthing process often much quicker, because one is just going with that process. Also, the recovery following birth can be much easier, and it can be without that, without further discomfort. So it can be so much easier, so much more comfortable, and with an incredible quality of presence that's possible.
Psychotherapy is not only a profession, it's a state of being. And for that, it requires continuous learning, training, and refining your skills. If you would like to become better in your role as a psychotherapist, come and join Dr. Warwick Phipps for in-person training at Treatment Work Center, where you will experience training like never before from a thought leader and expert in psychotherapy. If you would like some more information on our training or to book a training session, please visit the link in the description. And also, if you find these podcast episodes meaningful, please subscribe to The Art of Therapy. It can just, when you talk about the childbirth process, it's when the discomfort level is taken down and your recovery is or the process is also quicker and the recovery is more quicker.
Yes.
And you can be more present and taking in that moment. That can really be meaningful.
Yes, yeah. There's so much possible with hypnotherapy, and to think that a woman could be so greatly helped and through the utilization of this and experience childbirth even more meaningfully. That's really something.
Yeah, and there's a lot of work around any pain but any procedures as well. And then one of the parts is the childbirth, the hypnobirthing as well.
Yes.
And I think something that practitioners also deals a lot with is trauma in therapy.
Yes.
And where just with hypnosis, with trauma, how do they work together?
Phew, this is a big one, because many people suffer with trauma and the effects of trauma. And in hypnosis, the first thing is that one can experience this profound relaxation, and that can in itself be great relief, as we've noted, but the safety, security, when someone is experiencing hypnosis, that can already be a corrective. But in addition to that, there is the phenomenon of what would be called therapeutic regression or hypermnesia, which is a very, very accurate recall to the point of literally being able to experience and re-experience any part of one's life. Again, it depends on, as long as there's not any kind of neurological injury, head injury, some disease process. And I don't want to be absolute about it. The important thing is that we have an ability to recall, but in such a vivid way, revivification, early experiences in our life that we just can't consciously, cognitively get our head around. And in hypnosis, it's something of like a time capsule. One can go back to experiences. And these experiences can be any experience that's meaningful. So what one has is a capacity to work with trauma, either being able to help someone, they get to understand aspects of it. They can re-experience himself before trauma, because many people have been so affected by trauma that they really only know themselves or think about themselves in terms of trauma and the impact of it. One can help someone work through some aspect of trauma that felt completely overwhelming. The principle is always with trauma work is someone always needs to work through something by way of understanding a situation, coping, moving, developing. And so in hypnosis, whatever therapeutic skills and abilities and a therapeutic orientation that one has, the more profoundly one can assist someone with trauma in the hypnosis state. Also, as quickly as we can bring anything on in hypnosis, we can take it away via suggestion. So normally when one is working with trauma outside of hypnosis, should someone become distressed, it can be more difficult, especially if they've brought up that trauma. It can be more difficult to assist them. They can feel deeply overwhelmed. But in hypnosis, you can remove it very, very quickly. So it provides a degree of, for the client, control and safety that is quite something. And the main principle here with hypnosis is, you wouldn't do anything with someone in hypnosis you wouldn't do out of hypnosis. So you first need to be really comfortable, trained, and really skilled in working with trauma outside of hypnosis. But now you work with someone in hypnosis, and it can be deeply meaningful and even more effective, utilizing many hypnotherapeutic applications, but such as regression.
Yeah, it makes so much more sense describing it like that. That it is you can work with trauma, and just like you would work with trauma outside of hypnosis, you work with trauma in a hypnotic state.
Yes.
So it's the same knowledge, it's the same expertise, it's the same process, but it's in a hypnotic state, and that can actually help the client in working through it quicker and really helping them to work through the trauma.
Yes, that is so important. Also, what's key to understand is that because one can move so much more easily in hypnosis, help someone, just as someone can better understand and process and work through and have a corrective of something very painful or disturbing or distressing in the past. In hypnosis, we have a remarkable ability to be able to focus about the future, to envision a future, to see something. And that can be profound because working with hypnosis and working specifically with trauma, someone is often stuck around the disturbing aspect, the distress. It's very difficult for them to see a future. What would that future look like? How would they be? They're often oriented around just trying to feel better and try and manage this terribly disturbing experience. So one can go forward in hypnosis and envisage the future and think about a future in profound ways. Often that we know is going to be in subconscious terms, much more than just a conscious thinking about the future, a subconscious expression of that. So wow, that we can move, we can go back in time, age regression, and effectively think about a different and a new future, a hopeful one. There's just so much that one can do in the hypnosis state.
It really is. There's any therapeutic application, any therapeutic help that can be done out of hypnosis, can be done in hypnosis.
Yes.
And it takes the journey sometimes much quicker and more profound for a client.
Yes.
And it just makes you think if then with addiction or working on self-esteem or assertiveness, all of those things that practitioners can use out of hypnosis can help and assist a client in hypnosis then to achieve that.
That's the key. Because hypnosis or hypnotherapy isn't in itself a therapeutic orientation. Hypnosis, as we've explored, is a naturally occurring phenomenon with certain qualities. And so it's how does one utilize one's existing therapeutic knowledge and expertise, but now with the adjunct of the hypnosis state. And that's where the therapeutic effect can just be really meaningful, effective.
Sure. Well,
And as you say, that may, if you're comfortable in your expertise working with addiction, whatever you can do out of hypnosis, when you understand and learn hypnosis and you do some of that within hypnosis, is even further strengthened because you're going to utilize your therapeutic orientation around addiction and utilize that within a profoundly relaxed state where there's a capacity for learning, understanding oneself, and experiencing things very vividly.
sure. That just it's understanding hypnosis and hypnotic states and being in a trance state. There's really so much benefit from it, and how a therapist can utilize that.
Yes.
It almost makes me wonder then that if we understand the trance hypnosis, then so I'm just wondering, is there another form of hypnosis?
Yes. Yeah, so hypnosis has different expressions, different forms, and in different types. It's what we've been looking at really is hypnosis that involves eye closure, that increasing comfort and relaxation, in a sense, going inward, and often looking like a sleepiness or sleep, but as we've learned, no, inwardly, subjectively, very high awareness, but just complete, utter relaxation. But for all intents and purposes, very often is eye closure. And that would be really understood, again, as trance hypnosis. That's the conventional term, a way of looking at it. And yeah, that's one expression of hypnosis. But there certainly are other expressions of hypnosis that are potentially very valuable.
Okay. Maybe if we can pause that there, and then in the next episode we can start to have a look at what is another form of hypnosis.
Yes, I look forward to that.
Okay, me too. Thank you for joining us on The Art of Therapy. If you found this episode meaningful, or if it expanded your knowledge, we would love to hear from you in the comment section. We are looking forward to continuing this journey with you. Until our next episode.